It's Dr. Cassie Smith, and welcome to Back to the Basics, a simple approach to health in the modern world. I appreciate you taking the time to join me today and hopefully learn ways that could help you improve your health. The modern world has left little time to focus on health and wellness. I hope to give you some quick and simple ways to be well and live your best life. Hello, welcome to this episode of Back to the Basics. I have a very special guest today. I'm super excited to introduce you guys to McCall McPherson. She is now my friend, but is the founder of Modern Thyroid Clinic, a thyroid-centered functional medicine practice in Austin, Texas, and the owner and Chief-Hope-Giver of Thyroid Nation. She's a physician assistant, a TEDx speaker, and a thyroid and hormone expert by way of being a patient. Her passion for perfecting thyroid treatment stems from years of her suffering due to the mismanagement of her own hypothyroidism. So kind of similar to myself. She now lives, breathes, and thrives in understanding the nuances of proper thyroid care. Her philosophy is simple. There's no reason to still have thyroid symptoms. She spends her time with patients to help them get their lives back and teaching and advocating for the other millions suffering who aren't her patients. So please help me welcome McCall McPherson, the founder of the Modern Thyroid Clinic. Thank you.
Thank you. I'm so glad to be here. Thanks for having me.
Yeah, I'm super excited to have you. So we, I think, have a lot in common, which is why I asked you to come be on this podcast. And I kind of secretly have been following you it's been like a year now. And so I love all your content. And I think that you are like me. There's not a lot of us out there. There's a few, but not a lot. And so I just wanted to have you on. And so we could kind of talk about thyroid in general and your take on it and just get some tips and tricks from you to help people live a healthier, happier life.
I know we are definitely soul sisters living unique parallel clinical lives and just in general. So I am so glad now we're friends, colleagues, all the things. It can be lonely in the thyroid world. So it's nice to have a friend.
For sure. Yes. And if any of you guys want to check out her TED Talk, I was just telling her that, she did this TED Talk several years ago before she kind of got into this realm. And it was very inspiring to me because it kind of talks about how she ended up where she was. But medicine is not, I've been posting a lot about this recently. Unfortunately, it's not super gracious and very humanitarian anymore. And it can make it difficult. But I love that she is very passionate about taking care of patients and listening to patients, which is kind of the nuance in medicine, right?
Absolutely. There's such a healing component to that so many people miss out on.
Yeah. So I guess tell us a little bit about you and what you do.
Yeah. So kind of similar to you, right? I am, very, very niched into the thyroid space. So I practice what's called functional medicine. So it's a good mix of, traditional conventional medicine, which is where my formal training is, mixed with a little bit of integrative kind of holistic approach. Definitely at Modern Thyroid Clinic, just like Modern Endocrine, right? We specialize in more progressive methodologies of looking at, specifically for us, it's thyroid. We really are like last ditch effort kind of people. No one comes to us until they've been to 10 other places. And we have a very, very unique algorithm for treating thyroid conditions that, allows us to give people, even with very, very complex disorders, back their lives. So it's a win for our patients. But as a clinician too, I'm sure it's so rewarding to be able to support these people. And I view our work in thyroid truly as it impacts generations, it impacts women, but families, mothers, grandchildren, communities. It's such a big thing that I think medicine doesn't appreciate yet. So it's the best kind of work for sure.
Yeah. And I think, a lot of the patients suffering with thyroid disease, you talk about this too. It's such a vague, broad array of symptoms that a lot of times, people just don't get listened to, or they get, thrown a SSRI or something that has nothing to do with their actual thyroid, because it's sometimes more difficult to diagnose, right? Because when we're in school, we're taught like, people all fit in this box, and not everyone's disease or symptoms of the disease are going to present the same. And so it is, sometimes more challenging to figure out, but when you do, and you treat these people appropriately, it's very rewarding.
It really is. And I hope that in our lifetime in medicine that we clean up kind of diagnostic measures for finding these people and seeking them out, and also just really appreciate that this condition is not like this minor thing that, oh, you just throw some levothyroxine at it and everything should be fine. It really is more complex than that. And if we address these people appropriately and take it seriously, it can have such enormous impacts on their lives.
Yeah, I would agree. What is one of the most common, or I guess top 3 common symptoms you think people with hypothyroidism have that you see in general?
Yeah, fatigue. Like, my people are tired people, you know?
Yes.
Bring me the tired ones. Those are the ones for me. So, fatigue, weight gain, hair loss,
Yep. I would agree.
all day, every day.
I would agree. Yeah.
Yeah.
And lots of menstrual irregularities too, right? I see a lot of that at
Oh,
least.
so much. Even when their TSH is like 2.4,
Yeah.
I'm like, wow, gosh, difficulty getting pregnant, maintaining pregnancy, even with pretty, reasonably what regular medicine would consider very mild thyroid issues.
Right. Yeah. And I mean, I know this, it's because the TSH doesn't matter as much as the free T3, right? And so I see this a lot too. I actually saw a girl this week whose TSH was like 2.2. You kind of nailed it. And her free T4 was okay. It was like 1.3, but her free T3 was 1.8. And she has had all these miscarriages and she can't get pregnant, and she has all the symptoms, and her OB is just saying like, oh, you're fine, you're fine. And she's not, and then also she's got other reasons that her T3 can't actually get into the cell. She's vitamin deficient and her cortisol is high. But anyways, it's very interesting, and it's frustrating because in medicine, even my society, we say, use TSH to treat the patients and don't listen to the symptoms and don't use clinical scoring systems. And, it's frustrating.
She is so lucky she came to you, because in the traditional medicine, over and over and over, she would have been rejected and shot down. And I tell my patients this, it's a strange thing to think about, but the worse you are at utilizing your T4 or your inactive hormone, or in the form of levothyroxine or Synthroid,
Yeah.
the better your labs look in traditional endocrinology, because your T4 looks awesome.
Mm-hmm.
And then that makes your TSH look great,
Mm-hmm.
but meanwhile, you're walking around with a T3 that is so severe. I only see T3s in the ones, a handful of times a year.
Yeah. And I'm sure you check reverse T3s. Do you check those labs? Yeah.
Mhm.
So
Absolutely.
on her reverse T3 was 56. That's pretty dang.
You're kidding me.
No, it's pretty high. I don't see anything usually above 30 very often, ever, hardly. Yeah.
Right. The only times I see like 50s, I've seen one above 75 and one above 100. It's like an extreme diet rigidity and like starvation over exercise. Like, these people are trying so hard to manage their lifestyle because they're so desperate that they're going to like unhealthy extremes. And then their reverse T3 skyrocketed. I don't even know how that girl made it to your office. I wouldn't have gotten out of bed. I mean, that is so awful.
Yeah, it's crazy. Well, I don't know how she got pregnant, but she did, probably because she's young. But yeah, it's so reverse T3 is really important too, right? And then her iodine was low, shocker. Her D is low. Everything she needs to help her isn't there. So frustrating for her
Gosh.
because she's like, I've seen all these doctors and no one's told me that. So
Yeah. Yeah. No, she is so lucky she landed at your office, because that poor girl.
yeah. So what are some of the things that you talk to patients about as far as like how, people ask me this all the time. Well, how do I get this reverse T3 less than 30? What do I do? What are kind of your top 3 things they can do?
Yeah, so I view reverse T3 in 2 main ways, and I'd love to pick your brain on this
Okay.
because let's be real, there's not many people I can pick their brain. I view like part of reverse T3 or like a category of people as standard American lifestyle reverse T3. That's, anywhere from 15 to 25, maybe 27. And then I view like 30 and above as something significant out of the ordinary is going on, or they are being put on an absolute excess of T4 hormones. And so I view them as like, hey, we're all walking around in America, at least that's my data set, right? With excessive reverse T3 because we're stressed, we're kind of inflamed, we're not sleeping well, we're not eating great. And so most people have this disorder of activating their T4 and instead dumping it into reverse T3. And so those people, it's like absolutely you can work on lifestyle. So reverse T3 is an inhibitory hormone. Your body uses it on purpose to make you lay down, rest, recover, right? It wants you to heal. So it tries to make you tired to do so. So you can kind of reverse engineer that. Like if it knows you're calorically restricted, it drives up your reverse T3 to store fat and not burn through it, to hibernate, right? So you want to eat adequate protein. You want to get adequate micronutrients. If you're inflamed, you want to decrease inflammation from food, from stressors, from your environment. You want to sleep well. You want to not over-exercise, not deplete your body. And so those are like kind of the standard American sort of reverse T3 levels to a degree. But I'm a very big advocate too for, I think, especially because people that come to Modern Thyroid Clinic are like so desperate that I try to manipulate their biochemistry with medication so that they can feel well enough to improve their lifestyle. So, I'll reduce their T4 a little bit. I'll increase their T3 a little bit. I'll drain some of the source for that inhibitory hormone so that they can feel well enough to eat well, to exercise, to get enough rest, to pour into their lifestyle and have the capacity to do so. So those are kind of my thoughts. Tell me yours.
I love that. Yeah. I'm a big advocate of helping these people feel better. I tell them when they come, I'm going to give you some medicine. It doesn't mean you have to stay on it forever, but we've got to give you some T3 so that you have the energy to do all the things you said, which is true. 93% of people in this country are insulin resistant, and insulin resistance is one of the biggest drivers of upregulation of that deiodinase that makes reverse T3 instead of free T3. So if you're insulin resistant, which is from, usually our sad diet, but other things as well, these people are just pouring out reverse T3 instead of free T3. And I agree, it's really hard to get off the couch and it's really hard to go to the store and make good food choices if you have no energy. So I'm kind of in the same boat as you. I always tell people, I want you to not have to take medicine and to heal your thyroid if you can, but we have to start giving you the right stuff so we can go in the right direction. So I completely agree. I see a ton of reverse T3s in 20, 25, 27, and it's all sleep deprived, stressed, people that aren't eating well. And you may be different in your clinic because you're kind of the last resort. And I still have an insurance-based practice right now, but I have a lot of people who will come to me and say, well, I'm not eating bad. Like I sleep pretty well. And when your triglycerides are high and your LDL is high and your HDL is low and your insulin's high and your CRP is high and your uric acid is high, you're not eating well and you're not sleeping well. I don't care what you say. Like maybe your lipids are a little off because you have a genetic issue, but that also doesn't drive your insulin up and your CRP and your uric acid and your glucose, so it's just, I agree with you. Like I can, and also their waist circumference, right? So you can measure someone's waist circumference and see if they're metabolically healthy. And so we have these conversations and then, but it's okay. We all start somewhere, and I was that person 10 years ago. I didn't take very good care of myself in med school or residency or even in fellowship, but And I'm still working on taking good care of myself. Today I had a list of things I should have done, I thought, but I relaxed instead, and I'm glad I did. So, I would agree with you. Like, a lot of it is just changing our lifestyle and everything that you said, what you eat, how you sleep, what you think. I think that's a big one too. There's a lot of science now with your brain and positive thinking and mindfulness. And so that's a big one as well, I think, in this country. But yeah. And then if it's above, I'm the type of person where if it's high, no matter what, even if it's 17, 18, 19, I'll still give somebody some T3, either Cytomel or I like NP thyroid, some of the desiccated, just to kind of help get them going in the right direction. I love that. And I take kind of a holistic approach like you. I know you guys focus on thyroid, but I look at their micronutrients and we fix that. And we look at their gut and we look at their insulin and we look at their hormones. Like, I try to give them as many options at once as possible to get them moving in the right direction. So that's how we do it.
I love that. And I think, I totally agree. If it was just as easy as someone coming to us and all we had to do is fix their thyroid and it's like, okay, bye, you're good, that would be great. But it's so much deeper for these people. And these systems are so integrated, that your thyroid issue leads to hormonal issues, leads to insulin resistance, and it just spirals. And so I love that you are able to take that approach and are offering that to people on an insurance model too. Is like, I don't even know how you do that. That's so intense, but hats off to you. And I also love that you guys check reverse T3, because so many people, even in the progressive thyroid world, say, oh, you don't need to check reverse T3. You don't need to. It's not valid. And I'm like, no, I actually look at it all day, every day. It is very valid.
Yeah.
And it's very necessary.
Yeah. And there's a huge correlation if you look at it, in my patients. You can tell when it's high and when it's coming down, right? When they first come to me, it's really high. I would agree. It's very valid. As insulin levels come down, as CRPs come down, as fasting glucose comes down, as hormones get better, reverse T3 goes down. So I completely agree. Like, it's very valid. So it's that cortisol as well. Like, insulin, and what's frustrating too, insulin, cortisol, and reverse T3. I mean, you can check those 3 labs for $60 probably at cost, maybe less. And then insurance companies, in the insurance world, they, will deny those claims. Those aren't medically necessary. Patients end up with these big bills. And it's just like, are you kidding me? This is the best thing you could check in these patients to actually, give them an idea as to CRP. That's another one that's just crazy that, we can't check that either. And so it's frustrating, but they're very valid labs. I would agree with you.
Yeah, absolutely. Yeah, no. And it's like, why not check all these things that really, to a huge degree, promote long-term health and wellness, prevent heart disease, the number one killer of like men and women globally. We can intervene on these tiny little things early on, or we can wait until it's a big giant monster, and we're choosing to wait over and over.
Yeah, that's our healthcare system is very broken. It's very, we utilize the ER for primary care. We kick the people out of the ER and they come back to the ER for more primary care. By the time they get to you or it's, it's not uncommon for people to leave my office. So they come in the initial visit, they, spill their guts. They get a bunch of blood tests, and then they come back the second test or the second visit, and we go over all the tests. And it's not uncommon for people to leave with 9 or 10 diagnoses. And when I first started doing this, I was like, man, maybe I'm just like overdoing it, like maybe it's just me. Maybe I shouldn't be checking all these things. I should, because it's overwhelming. Like, everyone has vitamin D deficiency. Everyone is insulin resistant. Everyone has thyroid issues. Everyone is, just metabolically unhealthy. Most people have iron issues. Their iodine is low. But then, this is kind of what led me down this path, is I was like, man, I mean, I'm missing something, right? And so then you start looking at their gut and you're like, okay, well, nobody's absorbing anything from their gut. That's that's why they have all these vitamin deficiencies. And then, their thyroid is also not working. And so they don't have hormone issues. And so it all just, it plays together so well. And from an endocrinology standpoint, it makes sense. But in this country, we just don't look at it like that. It's very frustrating to me. It's internal medicine does this and cardiology does this and pulmonary does this. And, this doctor does this. And people have like 8 doctors and none of them are, we're not putting our heads like what is causing all of this. And it's just so frustrating, it's crazy.
And I think we're even losing more and more that centralized piece because primary care is becoming so difficult for clinicians and physicians. And so that was like our one central piece that maybe could piece all the different sides and aspects of medicine together. But I fear in 10 years, 20 years, that might dissipate to a large degree because it's just so difficult and challenging.
Yeah, I did primary care for a year. I did primary care when I got out of residency for a year before I went back to fellowship. And it was the most unfulfilling, frustrating year of my life. It really was. And I mean, hats off to all the primary care doctors out there, but these people come in and they're sick and they've been in the, in the hospital, and you're supposed to go over all these vaccines they need and talk to them about their, mammogram and colonoscopy. And then also it's not sustainable to do in 15 minutes. And so you're right. I mean, the healthcare system, it's very broken, and we need to go back to teaching all providers how to look at everything, as a whole. The cardiologists need to look at things as a whole too, right? Somebody has a heart attack. It shouldn't be just stent them and kick them out the door. It should be, okay, what's contributing to this? We all need to kind of be on the same page, because a lot of these people are so sick, and because they come to you just how they come to me. But I think it's very important to at least let them know, I think it's very validating for these people to know, hey, you do actually have that, all these disease processes that are causing all these symptoms, and then let's start attacking them and fixing it, right? Because it is overwhelming. They don't feel well. They have a lot of stuff to work on, but at least if, they have somebody like you or I that are helping coach them through it, and they see, hey, we're going to work on all this, I feel like people get better faster, at least, right?
I can't even tell you. So, I mean, because of my particular niche and because of the people that come to see me, like 99.9% of my patients are women. And I can't tell you, like, almost every last one of them on my first appointment with them when we're reviewing their labs, they literally look at me as I'm reviewing their labs and they say, so you're telling me one of two things. They all say either you're telling me this isn't in my head, or so you're telling me I'm not crazy.
Yeah.
So it is more validating than I think we could possibly imagine, because these people have hit wall after wall after wall after wall. And yes, they leave your office with 8 diagnoses, but it's because the 10 other people they saw before you blew them off, and they never got any answers or clarity. And now you are giving that to them. And that is so incredibly powerful, I think.
Yeah. And it's frustrating from my standpoint as a patient at one point also, but as a physician, when a woman comes to me and says, I've seen 5 doctors, and yes, they all say I'm crazy. Why do they have to be crazy? I guess my thought is, like, if a patient comes to you and says, I have electrical shocks from my toe to my head, and I have, whatever symptom they have, why is it the first thing that a physician says is they're crazy? Why couldn't it be, well, maybe there's something I need to investigate. Maybe there's something I don't understand. Maybe there's, you know what I mean? We all went to school to help people, and I don't know where we lose that. That's what's frustrating to me. At least that's why I went to school, to help people. And there's so much research out there, and yeah, you're busy, but I guess that's where it really, really upsets me or fires me up when I see these women who, I've seen 5 doctors and they each put me on a different drug, and usually it's an SSRI, and they do basically tell them they're crazy and, you're just getting older. And why is that okay though, as a physician? Why shouldn't it be, maybe I should listen to this person, and maybe I should try to figure out how to help them? I don't know where we lost that in general in medicine, but that's what's really sad to me.
Devastating. I couldn't agree more. And I mean, I think it's a couple theories that I have as a clinician and as someone who is written off, it's like people don't have time, they don't have capacity. And so eventually they lose that realization that this is a real human sitting in front of them that's there, they're asking for help, and they just lose sight of that. And then second, I think their egos sometimes can't handle it. You know, they're like, well, I don't have the answer for this, so this can't be real, you know?
Yeah, that's a good one. I hadn't really even thought about that, but you're probably correct. Yeah. And that's sad though, right? Because if you have that big of an ego, then you're probably not in the right profession. Right. I'll be the first one to tell you. My staff will be the first ones to tell you I mess stuff up every day. I just admit it. Like, man, I totally messed that up. I didn't do that right. Or, I don't know the answer to that. I had a lady this week who came in with this extensive mold testing. Just all this crazy mold testing. She's done cheat therapy. She's done all these things and she was feeling better. And then now she's not. And she's like, you have to help me. No one in Oklahoma City will help me. Nobody will test me for mold. Nobody. And I just told her point blank, I was like, I 100% believe you. I have no idea how to do this. I will go home and look and I will do some reading and I am happy to try to help you. But we might have to call the doctor in Ohio that did this for you before. And I'm happy to be on the computer with you, but I don't know how to do this. And I'll just tell you, I'm more than happy to try to help you. I love to learn. There's a ton of stuff I don't know. I just kind of got into the functional medicine realm like about 4 years ago now. So I'm still learning a lot of stuff, but I don't think she's crazy. She has significant symptoms, it's fascinating to me that doctors think that patients would come back and come back and come back and waste their time and their energy and their money if they really felt well, right? I mean, like we have so many things to do.
What to be doing.
Yeah.
Right.
Like women, and the other thing about women too, and you'll probably appreciate this. I appreciate this the older I get. Like in general, we're pretty like just stoic humans, right? Like we just go and we take care of our family and we take care of our kids and we take care of everyone else. And we're usually the last person that we take care of. So when I have a woman in my office that is crying and that doesn't feel well and just says, I've kind of given up, I just like my heart hurts for her because I know for a long time she just did and did and did and is at a really bad place typically. And so to think that, they go somewhere else and somebody says, oh, it's part of life, or you're getting older, or here's an SSRI, instead of trying to figure out like, how can we make this person more functional and better, is really sad. It really is. And I think you're right. It's just, we don't have time. We think we don't have time. But like you said, it's another human, and it's, showing some compassion and validating their concerns and trying to help them feel better is what we should all be doing.
And I think too, it helps because you and I were on the flip side of that conversation. I mean, I certainly was, at 27, I was told, oh, you're just getting older. And I was like, yeah, I'm not getting out of bed. Like
27,
I'm 27,
yeah,
something isn't right here. So yeah, it's easy to hold on to that empathy a little bit tighter when you've been on the receiving end of that, I think.
Yeah. Yeah. And I don't know. It's just, there's so many things. I was on the other side of it too. Right. And it's like, oh, well, you can't be that tired. You've made it through med school, or you can't be gaining that much weight. You're not that heavy, or you can't, it's just everyone's journey in life is different. And everyone knows themselves the best, and you have to be your own best advocate. Right. And so it's just frustrating that med school and what we've done in medicine is put everyone in these boxes, right? And you just have to fit in a box or you don't. And that's just not, it's just not how it should be. And I'm really hoping in the next 5 to 10 years, people start demanding patient-centered, individualized healthcare. But I don't know how you fix that at a national level. But I think if we did, we would have so many more functional, healthy individuals, and we would be saving so much money in this country because we spend so much money on sick people. I mean, I don't know how much you see it. Because I take care of people with diabetes, so I see a lot of it, and it's just really sad because most of it can be avoided, right? Type 2 diabetes could all be avoided 100% with lifestyle and education.
Right. Yeah. And then too, the other side of that coin is clinicians would also be so much happier.
Oh,
With patient-centered care, it creates a mutually beneficial relationship where their souls are nurtured. What they went into medicine for is realized. And then the patient also is healthier, has more vitality. It's like a win-win. So I hope at some point it shifts. And I do think that's where in the interim, functional medicine, cash pay practices can come in handy because we're not having to see people in 8 to 15 minutes.
yeah. No, I completely agree. My dream one day is to spend an hour with
I know.
patients because, to be honest with you, sometimes I do. So I always run behind. So my patients are usually, they're very gracious generally. They'll wait because they know that I've spent an hour with them, but it just makes for really long days. But you're right. It's just different. Like from 2017 to 2020, when I worked for Mercy Hospital and saw a patient every 10 minutes and just, I was so unhappy. Like my husband will tell you, I would come home every night and I was just like, what am I doing? Like I drank a lot. I was not in a good place. And, I remember I woke up one day and I told him, I was like, I just like you, I said, I don't think that medicine is what I was supposed to do. And he was like, what are you talking about? Like you love people, you love, I remember very vividly telling him like, I just don't think that this is for me. Like it's not what I thought it was going to be. Nobody's getting better. I'm just giving people more drugs. I'm not happy, and my husband's in finance and he said, Cassie, you owe $500,000 in student loans. You're going to be a
Right.
doctor. Figure it out. I was like, dang it. But that's what kind of led me to functional medicine. And I will tell you now, though, it's very different. I love, I have all these, I take care of men and women, mostly women. I would say 80% women, but I have a ton of women who, hug me and tell me that they love me and I've changed their life. And there's no better job in the world, right, than that. Like, I don't know how it gets better than that. When somebody, you've seen somebody at their worst, and I've seen a lot of people at their worst crying and, and then they come back and they're just like a totally different person. And it's very rewarding. And so I don't know, I'm excited. I think you and I are going to do some collaboration, and I think that we can help the world and help a lot of people and hopefully help some providers. But
I know.
So many
Because
people.
my heart hurts for you too, like for clinicians too, that want to realize what they went into this for, and they lose sight of it, just like you described. I mean, I think you probably heard my story. I told my parents, I'm like, I want to quit. I want to be a contractor. I want to do physical labor.
Yeah.
Yeah, clearly I was just not in my right
Mind.
niche
No.
of medicine.
No. Yeah.
Or
No.
mine.
Yeah, I agree. I just remember telling my husband, I want to do anything with this because this is not what I signed up for. But I'm very happy. The last 4 years, I have been much happier. I'm in this, I'm happier. It's a lot of work. I'm working on a few things, but it's very, very validating to help people feel better. And so then that's where I kind of got fired up with this. Like, we have to figure out how to fix healthcare. We have to figure out how to help these patients find help, but then also help providers learn that, it's okay to listen to patients. It's okay to, think outside the box. It's okay to treat a patient, not a lab. It's okay to treat a symptom, and then I think, I was laying in bed last night, just really thinking like, just how do we at a legislative level, or like, how do we fix medical education? Because that's where it starts. I remember in residency, like when you were taking care of patients in the hospital, it was like, as soon as their numbers looked good, it was like, kick them out of the hospital. It wasn't like, how do you feel? Are you, can you walk? Can you breathe? It was like, oh, their numbers look good, kick them out of the hospital. They teach you this from the very beginning of medicine. And so how people feel matters. Whether they can actually walk out of the hospital matters. There's so many things that matter, but we're missing it from the very beginning of education. So How do you fix that?
So much. And I mean, it's that
Yeah.
dehumanization of your patient,
Yes.
but also, and I don't have the full extent of being a physician. I'm a PA. I spend a portion of my medical training along with medical students, but the dehumanization starts even then of you're denied food, water, sleep.
Mm-mm.
No one cares how you feel. So you learn to reject your own humanity. You learn to reject the humanity of your patients. And that is how we are learned to operate in medicine. And I think it works. Like, I mean, I see physicians that go to work when they have the flu because they take care of their patients and that's what they do. And they don't care how they feel and they show up. So, in a way, I get it. Like, people that work in the emergency room need to be there. If there's a medical crisis, we need to have clinicians. Doesn't matter if they're tired. But I do think there needs to be more humanization of clinicians, especially, I think, physicians as well, you know?
Yeah, that's a good point. That's such a good point. I was so sick 2 weeks ago. I was so sick and I went to work every single day and I got an
Yeah.
IV when I got there and I came home and went to sleep. But I went to work every day. So
Doctors are the most hardcore people. Yeah.
we are. And I'm not super proud of that. And that's something I'm definitely trying to change. But it's true. The dehumanization is a huge problem, and I think that's why a lot of physicians can just kind of look past that and look past, or But sometimes I wonder too. Like, do you wonder? Is it just like you said, almost like an ego thing? Like people are like, some doctors are like, well, I don't understand this, or I wasn't taught this, or this is new, and so they just, if they don't know, their answer is, oh, it's in
It's
your
a
head,
psychiatric
or
problem.
yeah.
Yeah. It's not, it's an abstract thing. And it's so easy to write off psychiatric conditions as an abstract thing. So they're labeled. I mean, that's how I ended up in thyroid, was through psychiatry. So many of my patients had depression from their thyroid condition, that when I fixed their thyroid condition, their depression went away. It was like purely accident. I ended up in this field. And then they took my information, those people spread it all over the internet on thyroid forums. And then they created a thyroid practice for me from all of these women with depression
Yeah.
that actually had a thyroid problem.
Yeah, anxiety too. Do you see a lot of people with anxiety?
Yeah, especially with Hashimoto's.
Mm-hmm.
Usually the anxiety correlates with antibodies, or obviously like low progesterone. But
Mm-hmm. Yes, low progesterone, I would
yeah,
agree. And then because they can't sleep either, right? So progesterone affects your sleep. And then, yeah, I see all these women too. And it's young girls too. I see a lot of girls, college age girls that were fine. And then all of a sudden they develop Hashimoto's because they go to college, they were predisposed, they're eating terrible, they're not sleeping, they're not taking care of themselves, they're drinking too much, they get really bad Hashis, and then their anxiety goes through the roof, and then they don't want to go to class, and then they start failing out of school, and then their mom's mad, and then they end up in my office. And yeah, they end up in my
that was
office.
me.
And I remember 2 weeks ago, I had a mom that brought her daughter in, and she was just livid. And she was like, I've given this girl everything. And she was so angry at her daughter. And I could just tell her, her daughter was like, Mom, I just don't feel good. And she has really bad Hashimoto's, and she has really bad iron deficiency, and she actually has MTHFR. But we're going to fix her, and she's going to be fine, assuming that she'll fix her lifestyle a little bit. But yeah, I mean, it's, and I had really bad anxiety in my, early 20s, and even in my early 30s. My anxiety's gotten so much better. It's all my patients and my staff all the time say, how do you always stay so calm? And I'm like, I don't know. I mean, sometimes my head is not calm, but yeah, it's really sad.
Yeah.
Yeah.
And it is cool and special, though, that you and I both like get to take our pain, our journey, and turn it into purpose and turn it around to help other people. Is, again, it's just very rewarding. And it is like we're in the best situation in medicine to be able to do that. We're really fortunate.
Yes, for sure. Okay. So tell the listeners how, like, I'm going to link in the show notes all of the things you sent me. So everything about Modern Thyroid Clinic and your Thyroid Nation. But I guess you want to give them a little like brief, how they can find you, or what's the best way to contact you, or if they want to be a patient, any of that? Because I'm sure you get millions of questions about that.
Yeah. So, Modern Thyroid Clinic, just out of sheer demand, is actually expanding nationwide. So, we're rolling out new states basically on about a quarterly basis. I am so excited about this because there's just, there's not a lot of people that are very equipped to deal with complex thyroid conditions. So, I'm excited that we get to bring that access to everyone. So keep an eye out on Modern Thyroid Clinic. There is a wait list that you can get on where we'll notify you when we make it to your state. It's linked in all of my social media profiles. My favorite places to be on social are TikTok and Instagram. And I also have a thyroid empowered course. So for all the people that can't connect with us directly to become a patient, essentially I take them through, you know, what is your thyroid? How does it work? What is Hashimoto's? What seems to be the hiccup in your biochemistry? How does your medication work? Hormone issues, adrenal issues. And then it kind of culminates with a group lab review where you get to review your labs with one of our clinicians from Modern Thyroid Clinic. And they just kind of educate you on what's going on with your thyroid and even give you a plan that you can then take in turn to your clinician to implement, because we obviously can't treat you. So that's another really cool thing that I've gotten just powerful feedback on. It's been pretty sacred.
That's awesome. I love that. I love that. I've been kind of working on some course stuff too for just patients and physicians. And so I was working on a thyroid one and one for insulin. And I love that though, because education is so powerful, right? It's so powerful.
So powerful.
And there's so many people that actually do want to learn out there, providers as well. And so I love that you're doing that. I love that you're going nationwide, also a dream of mine. And that you're, willing to help educate providers and bring them on and help them help others. Because I think you kind of have the mindset like I do. We were talking about this. There's two types of people in the world when you start becoming successful. There are people who don't want to tell anyone what they're doing. And then there are the people who realize that they can't help every single person in the world. And, they don't have that scarcity mindset. And that's one of the things that I instantly liked about you is that you don't have a scarcity mindset and you really, truly do have a good heart and want to help as many people as you possibly can. And so I love that.
Yeah, there are too many people that are missing out on their lives and their families, and they need help. So we have to do it together.
I would completely agree. Completely agree. So one other question I thought of really quickly. So a lot of people ask, is there one particular supplement or, something that you would recommend with thyroid disease? Or do you say, you should get most of your nutrients from your gut? What is your take on that?
So I have kind of a weird view on
Okay.
this, and this is just what I've observed with my patients. And you can go on and on about nutrients that we need to get adequate thyroid function. For me, and it's kind of seems like you're the same, I want people to put in the least amount of effort and get the biggest bang for their buck in terms of energy in versus what they get out. And I find that like 95% of people with long term thyroid issues have adrenal issues. So, hands down, my very, very favorite supplement is by a brand called Orthomolecular. It's called Adrene All, and it has like some micronutrients and minerals to support your adrenals, nourish them, but it has cow glandular adrenal gland. And it is a huge, huge complement to fixing someone's thyroid because I find if you fix their thyroid and you don't address adrenals, often these people are still tired and they're still foggy. But if you do both, so powerful. So, hands down, that is my favorite supplement. If you follow me on social media, you'll hear me talk about it all the time. My husband's like, why do you talk about adrenal so much? I'm like, because it's life changing. Like, I have to let people know.
I love that. Okay.
So, yeah.
Okay.
No.
Okay. So I have a couple of questions as we end that I kind of am going to ask all my guests. So what is one easy health tip anyone can do that will help their health? Just give one just very basic thing that you think anyone can do. A lot of bang for their buck.
Green juice.
Like what's in their green juice?
Like cucumber, spinach, kale, a little lemon, but various greens that have potent micronutrients that, not a smoothie, that don't occupy a lot of space and are easily absorbed into your gut. So all the fibers removed. And it is an easy way to get a ton of micronutrients and flood your body with micronutrients with very little effort.
So they're just putting that in a blender with ice, no milk, or how are we making it?
We're actually making it in a juicer, or we're ordering it from a juice place. Alchemy Organics is one that we have in Austin. They ship nationwide. They're like the best of the best of the best cold pressed juices. So not a smoothie, but a green juice. So put through the juicer, all the fibers removed.
Okay. I'm going to have to look this up. All right. So I was going to say, what's the one food that's most beneficial and why? If you just had to pick one food that you could eat, you didn't have to get from a juicer, or just that would be easy, you could keep and just snack on, what would that be?
Ooh, that's so hard. For eggs.
Okay.
I mean, eggs to me are such a great source of choline, of protein. It's a complete food. It's easy. For me, a lot of it is about ease, but I am a big protein and micronutrient person.
Perfect. So
for sure.
However they want to eat them, hard boiled, scrambled, just eggs.
Yeah.
Okay.
Fair. Yeah. Eat them however you want them.
Okay. I love that. And the last question I have for you is, what's the one thing that you wish you would have known 10 years ago about your health? What would you have done differently?
10 years ago.
Well, I mean, I guess that's hard because obviously you're kind of like me, but I'm trying to just get at what is the one thing you would have changed 10 years ago or changed prior to your diagnosis? What's something you would have done differently to make yourself healthier?
I would have been more mindful of the people that I allowed into my life and how they made me feel.
I love that. I'm working on that. I think that's hard when you're in your 20s, right? You want to, you're worried about what people think and what people, will say and what you're supposed to do and what, your parents want you to do. And then you transition into your 30s and it's still kind of hard, and you still, are kind of like worried about your parents, but not as much. But then it's kind of like your friend group and your husband. And then as you get closer to your 40s, you're just kind of like, at least me, you're just like,
don't care.
Yeah, well, yeah.
Don't care at all.
Yes. I actually made a post about
and it feels so good.
So good. I made a post about that this morning. I love that mindfulness about who you let. And the more I focus on mindfulness and the more I am happy, like truly happy, the more when somebody is in my space that is not making me happy, the angrier it makes me. Does that make sense? So like I have a patient that comes in and they're just being a complete, butthead to everyone in my clinic, and they're screaming at the front. Before I would have kind of been annoyed with that, but like now I literally will stop what I'm doing and go up front and be like, you need to leave. Like, this is not the practice for you. Like I'm not tolerating it, like the more you're happy, the more you're just like, I don't want any of that unhappiness in my life.
I know. And it's freeing. I turned 40 last year and it was like a switch went off of, I actually don't care. I want to protect my space, my family's space. I want to cultivate a life that I love. And that's how I base a lot of my decisions now,
I love that. Well, thank you so much for doing this with me. I'm super excited. I'm sure maybe at some point we'll get back on here and talk about some more stuff, but I know patients love thyroid. That's the number one thing they ask me about. I know that's the number one thing they ask you about. So I think this will be a great start. And then maybe we can see if there are more questions and at some point do it again.
I'd love that. This was wonderful. Thanks for having me.
The information presented, including any materials discussed, referenced, or linked within this podcast, are for general educational purposes only, not the practice of medicine. No doctor-patient relationship is formed from you listening to this podcast or utilizing any of the information provided. I am a doctor, but I am not talking to you as your doctor. The information provided is not intended to diagnose or treat health problems, or take the place of the professional medical care provided by your doctor. If you are experiencing any health problems, including problems you believe have been touched upon in any respect within this podcast, you should consult your doctor about the problems without delay. You may ask your doctor whether he or she believes the information I have provided would be helpful to you, but you should still consult your doctor immediately and follow his or her medical advice as your treating physician. I'm just here to provide you basic knowledge about the issues we discuss so you are more aware of them and can better discuss them with your doctor. That's why we call it Back to the Basics. Join me on the next episode as we continue our journey.